Today my topic is the responsibilities and the duties of the medical officer of health. For, right. So we have to know who is the medical officer of health and what is the MOH office. So if we divide the health sector into preventive and curative sector, I'm going to talk about the preventive sector. So MOH area is the smallest health unit in the public health network, and it consists of a team comprising several categories of staff. So MOH is the manager of the MOH office. He or she is not just an administrator. So in MOH office, we are supposed to do, we are dealing with the general public, not the patients. The people who are coming to us are normal people, normal people. So we are providing care for expecting mothers, vaccination and care for children, family planning and women services, field response for prevention of communicable diseases, food and water sanitation, environment and occupational health services. In Sri Lanka at the moment, we are having about 336 MOH areas, and every household belongs to MOH area. This is the strength of our public health system and the reason behind all our public health achievements. So, if we take the administrative structure, usually one MOH usually belongs to provincial health ministry. There is provincial health secretary in the provincial health ministry, and under him or her there is provincial director of health service. And there are technical staff as well in the provincial director of health office. There are consultant community physicians to guide us. And under the provincial director of health, there is regional director of health. So he is the immediate supervisor of us. And there are technical people in the RDHS office as well. They are MO maternal and child health, regional epidemiologists. If we take the administrative structure of the MOH office, medical officer of health is there, is the team leader, and to help her or him, there are additional medical officers of health. So technically they are in the same level, but administrative-wise, medical officer of health is superior to them. So under MOH, there are primary health care units, central dispensaries, the MOICs are there, and there are community dental clinics where there are dental surgeons, and in school dental clinics, there are school dental therapists and health entomological officers are there. For maternal and child health part, there are supervising officers, public health nursing sister, and under her there is supervising public health midwife, and there are public health midwives under SPHA. So the public health part, there are supervising public health inspectors, and under him there are public health inspectors. So all of them are technical people in the MOH office. Other than them, there are non-technical people as well. There are clerical staff, development officers, and management assistants. They are handling the money and they are planning projects. All those things are done by the clerical staff. And they are there to help you in preparation, presentations, and other documents. So, in addition to that, there are drivers, laborers, and tenki workers. They all are non-technical people in the MOH office. So as a whole, anyway, you are the leader and you are the team. Right. What are the main duties of different staff categories in the MOH office? If you take the MOH, he or she has the overall administrative authority of the MOH office, and he or she the focal point for the public health in the designated area, which include maternal and child health, prevention and control of communicable diseases, and environment health. So he or she is a team leader because in MOH we have to work as a team, and MOH is the head of the institution. So there are MOHs, they are authorized to perform all clinical, community level and supervisory duties of the MOH office. Then there are public health nursing sisters. They are mainly for supervising part. They are supervisors of the maternal and child health services. They have to supervising public health midwives and public health midwives as well. And the public health nursing system is responsible for maintaining vaccine supply, storage, and cold chain maintenance. But the vaccine of the MOH office, the responsibility goes to MOH. At the end of all the responsibility of each and everything goes to MOH. And she has to prepare returns related to maternal and child health. And she has to now, we are having web-based systems, so entering data into ERHMIs. But although she has to enter, the MOH is responsible for approval of data. So as a MOH, you have to go through the data, what she has entered into system. You have to know your technical work as a MOH before you approve the data. So go through the data before you approve any data. Before you put your signature for a return or record, please see what is there in the document because they are our data. And the SPHM, she's the immediate supervisor of the public health midwives, and she has to support public health nursing sister in preparing records and returns, and she has to organize and conduct clinics and local conference at MOH office. So, who are the PHNs? They are the most important people in the MOH office because they are the grassroots level workers who go to the doorstep of the people and find out their problems and uh, deliver services at their doorstep. So one PHM is allocated for 5,000 population according to the extent of the area. In urban areas, usually one PHM is allocated for 5,000 population, but in rural areas, it may be 3,000 population. So every house in this country is designated to a PHM. They visit the houses in their areas and register eligible families. If one PHM is maintaining her eligible couple register is the most important document in the PHM's office. So if one PHM is maintaining and updating her eligible couple register properly, that is the foundation. All the other records and returns depend on the data in that particular document. So each and every PHM has to maintain and update their eligible couple registers. And what is at the end, their service has resulted in lowering maternal mortality ratio, perinatal mortality rate, and the infant mortality rate in Sri Lanka. Then there is SPHI. He is the immediate supervisor of the PHI, and he has to prepare a lot of returns and maintain a lot of records in his office. And then PHIs, Public Health Inspector. Usually, one Public Health Inspector is allocated for around 10,000 population. So he has to perform a wide range of communicable disease prevention and control activities. And he is responsible for the food and water sanitation of his area. And he has to perform factory inspection, school health activities, rabies, control activities like activities. Then there are a lot of challenges as emerges when we are guiding different staff categories. So it's very the national figures are generated from the data of the grassroots level workers data. So we have to gather information in our area. It's very difficult to gather information from the people who are not coming for our service. If we take an urban area, 20-30% are not coming for our service. They are getting their services from the usually from private sector. So it's very because most of them are working population, so we are not meet them at during our working time. It's very difficult to gather information from. That is a problem for the PHMs. Then certain groups they don't come for our clinics like where women family planning clinics. They are reluctant to come for those clinics. It's another problem. In performing field level activities such as fogging, premise inspection, like that, it's another thing. Because during daytime, there are people are not available in the houses, so it's very difficult to go for premise inspection and fogging. There are influencers because we are technical as technical people, we have to do fogging according to need. But there are influences, when politicians, the influence people make influences in those things. And food grades, again, PHIs have a lot of problems when they are doing food grades. And the other things, nowadays we are not seeing vaccine preventable disease in the community. So in certain categories, they don't come for immunization because they see only adverse effects for this immunization. Therefore, they don't like come for immunization. And it's anyway, as a medical officer of health, we have to work with the political authorities. It's very difficult to convince them, but we have to know our technical work well. If we know our technical things well, we will be able to convince them and get the support of them for our work. What is the MOH of the MOH to clinical things? So we have to conduct conduct NCH and family planning clinics and provide field health care and refer for shared care. So as medical officer, my experience is we have to, as a medical officer of health, also we had at least once a month we have to do a NCH clinic. It will be a good opportunity to know your people. We have to know our people and we have to know our area if we are to be a good MOH. So it's a good chance to get the ideas of the people at a clinic. So it's good to update your knowledge to do a MCH clinic. And we are supposed to do field investigations for vaccine. The medical officer has to investigate all the vaccine preventable diseases. If there is a reported case of vaccine preventable disease, we have to investigate. Then on maternal deaths, within 3 months, within 7 days, we have to investigate maternal deaths and infant deaths. It's our duty. Then the supervisions. So usually we are doing technical supervisions, but as a medical officer of health, we can do administrative supervision as well. So the central dispensaries are under us and dental clinics, community dental clinics. So just visit central dispensaries and discuss the problem with the MOIC. So just and please go to the field and see what is happening there in the field. Because all your staff is there in the field. So just go and see what is happening in your field. It is a good time to learn about your field and your people. Then administrative and training. We have to send our returns on time to Family Health Bureau and Epidemiology Unit and RDH. Although the public health nursing sister or the supervising public health inspector will prepare the returns. But we are supposed to, we are the responsible people to send them on time. Then we have to support them, participate in meetings, reviews, workshops, and trainings. So we have to update our knowledge. Workshops and trainings are essential for knowledge. So we have to go for that. And reviews. Those means reviews and meetings. And you have to prepare for reviews beforehand. And conduct monthly conference and in-service training for the staff. So all our field workers meet at the monthly conference, that is once a month, and to update knowledge of staff in service training they have. So we have to conduct all, and we have to chair. And the planning. Detect and manage outbreaks, prioritize related issues and needs, plan accordingly. And we have to intersectoral collaboration, work with other sectors. How does it MOH lead the team? So, in monthly conference, we are having a monthly conference once a month where all of our field workers meet. And as a MOH, we have to be there from the beginning to end. That is a must. We have to be there. What are the things to be discussed? We should have an agenda for the monthly conference. What are the things to be discussed at the monthly conference? Usually, at the monthly conference, we have to discuss all the circulars and the letters received during the previous month. And we have to update our knowledge. And we have to evaluate the performance of each of technical officer, not only the PHNs, but the PHIs as well. We have to evaluate. It's a good chance to know our people and know our area and the problematic areas and to identify the gaps. It's a good time. Always ask why. Why your data is decreasing, why your data is increasing. You have to ask. It's a good lesson to prepare your presentation for the review meetings, national review meetings, because the midwife, the grassroots level workers know the problems in the grassroots level. So you have to know that. Then let your staff to speak at the monthly conference to improve their communication skills. And for the next month plan, you get together and plan your next month work. So those are briefly, those things are to be discussed at the monthly conference. Then in-service training. It's very, very essential. It's not a day of the public health nursing system. We are the responsible people to have in-service training because it's only for once a month. So you have to be present and to discuss with your staff one thing. If you don't have anything to discuss at the month in service training, there are enough books printed by Family Health Bureau and Epidemiology Unit. If you take immunization handbook, at least read one section with your staff and discuss it. It will be good to update the knowledge of your staff. So always try to be there in service training and monthly conference. So being an MOH is a golden opportunity for a doctor in many ways. MOH is an extremely important figure in the community. People in a variety of sectors collaborate with us. Politicians, religious leaders, community leaders find the MOH as a very important person in the society. So, be a good MOH. MOH has to communicate with people at different levels. So, in clinical sessions like antenatal sessions, uh, newly married sessions, you have to talk, you have to give health talks. But for political leaders, you have to advocacy for political leaders in the area. And these are the opportunities to improve your communication skills. And MOH invariably gathers a lot of information in routine work. So get the chance of this to your information. In addition, the setting, the MOH work would be used to generate research opportunities easy. There are enough resources in the MOH area. So try your best to do research as a MOH. It's very easy for a MOH to do research. Then, how to become a good MOH? MOH training, we are having MOH training at NIHS, about 2.5 months training. So it is very important as a medical officer. There are many things we need to know, for which we were not exposed as undergraduates. As undergraduates, we used to go to the MOH office for 2 weeks' time and observe what is happening there in the MOH office. But as a medical officer who is going to get the responsibility of a MOH, you have to know a lot of things. MOH performs certain specific jobs in diverse areas and the team leader. It is important to have a clear picture of the scope of work. And MOH needs to be familiar with the information flow. So supervision is a good way to familiar with the information flow. Because if you are going to supervise each and every area of public health midwives or public health inspectors' work, you will get the knowledge about the information system. So, uh, to be a good MOH, you have to know your information flow. The orientation as a MOH is extremely helpful to function optimally. So, MOH training is very important. Please go for the MOH training when you are asked to go. Then the advanced program. We all are field workers, so we have to prepare advanced program. So the MOH has to prepare her advanced program and submit it to RDHS before the 25th of previous month. Next month, the advanced program has to submit it before 24th of this month. So when we are planning our advanced program, we have to know the areas to be supervised. In your monthly conference, if you find out any problematic areas, any uh, staff member who is low, whose data are low in one segment, you know that. And according to that, you have to plan your advanced program. And all the others in your staff, they have to submit their advanced program before 25th to you. And you are the person who are supposed to approve their advanced programs. And advanced program is the document that would help in supervising officer to locate and supervise a field officer. And timely preparation will help to smooth functioning of the MOH. And it also allows to identify priority areas of fieldwork and plan accordingly. This is supervision. I always say for MOH, to work as a good MOH, supervision are very, very important. And it gives an excellent opportunity to identify where the gaps are. But we have to do supervisions very carefully because we are dealing with our own staff. But always think that where it's not fault finding exercise. So usually we do technical supervisions, but as a MOH, you can do administrative supervisions as well. So as a MOH or the MOH, we are supposed to do at least 6 supervisions per month. If you are planning your advanced program, each and every MO could do 6 supervisions without difficulty. Then, guide to become good MOH, adhering to the national guidelines. It's very important. So, epidemiology website and family health website, you have to use them. And you have to adhere to the national guide. It is very important, especially during these days with this COVID outbreak. We have to know everything in the new circulars. We need to get updated about that here to the national plan. And we have to deal with the parently. We know that we are not getting patients. We have to deal with the parental health paper. So they're coming to us. Uh, they are not coming to us to seek advice. They might not want to listen to us. They may even argue with our staff. Therefore, it is essential to adhere to national guidelines and keep the staff updated always. That's why I always say use your monthly conference to update your staff and in service training. Then preparation for district and provincial national meetings. It is essential to go well prepared. Don't allow the public health nursing sister or the development officer to prepare the presentation, and on the day of the review meeting, don't open the presentation there. You have to go through the presentation beforehand and know what would be the questions they will ask. So prepare for that. For that, you have to know your area, know your people, and the gaps and problematic areas, and how to overcome those problematic areas. You have to know beforehand. And the other thing, uh, especially the people from other sectors need our support to make important decisions. Therefore, we have to be thorough with the health situation in our area. We need to know our weak areas if we wish to improve. For that, we should have a good understanding of our population, our data, our strengths and weaknesses. You should be confident enough to present your data in the forum. Then collaborating with the curatives. We have to work with the curative sector as well, especially these days with the COVID outbreak. We have to work with the curative sector. And our mandate is the health of our people. We have to work together to achieve our common goals, which is a healthy nation. Then we have to get on notifications of communicable disease sign, and we are providing shared care for pregnant mothers. Those are the examples where we have to work with the cooperative sector. And at last, we know that there are regional epidemiologists and maternal and child MOs. They are at the district level. And in district level, there are consultant community physicians uh, who are guiding us in technical. So they all help us at any time. And at national level, again, the epidemiology unit and health bureau, they also help us in technical things. And the other thing is, there are enough guidelines, there are fact sheets, and there are a lot of documents to be read by us in websites of epidemiology unit and family health. So that's all I have to say. And I think to be a good MOH, you have to know your area, you have to know your people. For that, You have to go to the field. You have to do clinics and familiar with your people. So, hoping that the new doctors will be good MOHs and uh, thank you very much for the GMO for giving me this opportunity.